Hey guys, Dr. Sam, Newton Chiropractic Clinic. I just did a video on how I like to treat hamstring strains or pulled hamstring here at Newton Chiropractic Clinic. That video covered several different techniques such as adjusting the SI joints, the pelvis, using an instrument-assisted soft tissue mobilization or scraping to scrape out the hamstring, cupping the hamstring, as well as doing some dry needling to improve the functionality and the tissue quality of that hamstring. In between treatments, though, I like patients to do a few things at home, and I'm going to show you a couple simple things that you can do when you're dealing with the initial phase of a hamstring strain. So initially, when we're dealing with the hamstring strain, we really want to be working on normalizing the tissue and increasing the blood flow to the area to that hamstring so it can heal. So the hamstring is located on the back of the thigh, right through here. And so I like people to use a foam roller just to help improve blood flow to the area and help reduce some pain. And so what we want to do is get in this position like this and then lightly roll that hamstring out on that foam roller, okay? When you're dealing with the initial phase of a hamstring strain, you don't want to get too crazy. Just lightly roll through that hamstring just like that, okay? If you find a knot in there, you can lightly work that area, but like I said earlier, initially, we want to be real careful and just lightly work that area. We're massaging that area, reducing some of the muscle tension in the area, and just improving blood flow to the area so it can heal better, okay? So start with your foam roller, and then after that, we can move on to some simple isometric exercises. So an isometric exercise is activating a muscle without moving it through its range of motion, moving the joint. So the bicep femoris, or the hamstring, acts on the knee, and it also acts on the hip. So when we activate this hamstring in an isometric contraction, we don't want to move any of that stuff. There's a lot of different isometric exercises you can do for a hamstring, but I like people to initially start in a sit-up position or a glute bridge position. So what you'll do is you'll get on your back, supine like this, hip lightly flexed, knees a little bit less than 90 degrees, approximately like this. And what we're going to do is try and bring your heel to your glutes right here, okay? And squeeze your hamstrings, lightly bring in your heels back, and then relax. Lightly bring your heels back, and then relax, just like that. I tell people initially just start 10% strength, nothing crazy. Just lightly squeeze them and then relax. Lightly squeeze them and then relax. After you've done that exercise for a little while, then we can start moving on to a little bit more advanced one. So what we can do is move our heels out like this and then bring them towards our glutes and then relax. Bring them towards our glutes and relax. And really think about these hamstrings squeezing, contracting and then relaxing, then contracting them and relaxing like that. Isometric exercises are great because they activate the muscle in a safe place. It's not running through a whole range of motion. It's not going to get excessive stretch or excessive load. It's really good at pumping blood in the area, which helps bring healing nutrients to the area, but it also kind of calms down that resting tension that it's developed from this injury, and also kind of calms down that pain signal that you've developed after this injury. After we've done some isometric contractions and they're feeling okay, then we can move on to an isometric contraction and a hold. So again, we're going to get into that glute bridge position like we were in, something like this, okay? Hips flexed slightly, knees bent like this, and what we're going to do is squeeze our glutes, raise up. You can feel your hamstrings start to activate. Hold that briefly, and then slowly lower down. I tell people start light, bring your glutes up, feel those hamstrings activate, stop, hold that for a second, and then slowly lower down. As that gets easier and easier, then you can start to go higher, and then hold that position, tighten these hamstrings, and then slowly lower them down. As that becomes easier and easier, you can go higher and higher and hold, and then slowly lower down. Slowly lower down like that. And then, just like with the isometric contraction exercise alone, what we can do, bring our heels out, which is really going to activate our hamstrings good, and then raise up, tighten our hamstrings, and then slowly lower down. And slowly lower down, just like that, guys. So Those are some simple exercises, some at-home stuff you can do when you're dealing with a hamstring strain, and they work really great with some of the treatments I do here at Newton Chiropractic Clinic. All right, guys, just a recap on this video of rehab tips for a hamstring strain. I like people to start with a foam roller, just to improve blood flow to the area and reduce some of that resting tension after that hamstring injury. Then move on to isometric contractions and glute bridge position, and then isometric contractions and holds also in that glute bridge position. If you guys like this video, please hit like on it, please hit share on it. If you haven't subscribed to my YouTube channel, my Facebook page, please do. If you're in my area and I can help you out, give my clinic a call. Newton Chiropractic Clinic here in Newton, Kansas. Thanks.